Hello, welcome to Developing Your Learning Plan. My name is Susan McNeil and I will be your host for this video today. In this video, we'll identify the different sections of the learning plan. I'll provide you with some examples that will help you get started and also provide answers to some of your questions. So what is the Advanced Clinical Practice Fellowship? I'd like to give you a reminder of some of the three main benefits of ACPF. First, it's an opportunity for a nurse, an RN or an NP, to create an experience that is specifically designed to meet his or her own learning needs. Second, the ACPF fosters a nurse mentoring opportunity. This is one of the criteria for the fellowship, that an applicant has a mentor, and this can be rewarding for both the mentor and the mentee. And third, the ACPF opportunity helps the organization that the nurse is employed with to improve patient care by way of professional development. So the learning plan is the most important part of your proposal. Consider the learning plan as an outline or a map of your fellowship. And as you can see, it's worth 30% of the overall evaluation of the proposal, so I'd encourage you to invest sufficient time to prepare the learning plan. And here are a few tips to consider when you're developing your learning plan. So expect to collaborate to develop a plan. Your learning plan does involve other people, various activities and timelines, so you need to make sure that these are okay with all the people who are involved. And we encourage you to work with your mentor closely and have input from your sponsor organization, particularly if you have a direct manager who is involved. We also encourage you to ensure that your learning activities and the fellowship goals are really possible to accomplish within the time frame of 450 hours. So this is only about 12 weeks or 3 months. Think about what's realistic to accomplish within that time frame. So think about the time frame and then ensure that your learning plan is very clear. Be crystal clear about what you will be learning. In your writing, be clear. Don't assume that the reviewers who are looking over your proposal, that they know about you or your setting or your population that you're caring for. In other words, explain things as if you were speaking to a stranger. We encourage you to ensure that your learning plan is consistent with the overall proposal. So your learning plan should be tied to other parts of the proposal and overall should make sense together as a complete package. So be sure to have someone else who knows nothing about your topic to read over the proposal after you've done. One other thing to keep in mind is your learning plan isn't completely set in stone. So once you start your fellowship, some things may change and evolve. But remember that it is a map and you can end up taking a slightly different route to get to your destination. That's okay. Here on the screen is a table similar to the one in the request for proposals. You'll need to fill this table out for your learning plan, and it's divided into sections. So we'll be breaking these sections down into 6 steps. Starting at the top is your overall goal for learning. Step 2 on the left-hand side are your learning objectives, and you'll need to come up with 3 to 5 learning objectives, which are SMART learning objectives, and I'll explain what we mean by SMART in a minute. Step 3 are the activities that you will engage in to meet each objective. Step 4 is an explanation of who is going to be contributing to supporting your activities. In step 5, you include the timeline, so you put the start and end date for each activity. And lastly, in step 6, you outline the evaluation criteria that you're going to be using to determine that you have successfully achieved each objective. So let's start with your learning goal. Your learning goal describes what you would like to learn throughout the fellowship process. And I want to be clear that it is focused on your learning needs rather than on a particular project goal or an organizational goal. And keep in mind that goals are meant to be broad, overarching statements. So they're the end result that you're reaching for. And going back to the roadmap analogy, think of the learning goal as your final destination for yourself and for your learning. So make sure that your learning goal is consistent with and appropriate for the skill development stream that you have selected. It should be clearly identified and exactly as it's written in the abstract. And it ties together with other elements in the proposal. So in other words, the learning goal makes sense and it's congruent with what you explain throughout the proposal. For example, in the section where you describe the need for the fellowship and anticipated outcomes of the fellowship. So just reinforcing that point, consistency is critical. Here's an example of a learning goal, and this would be an appropriate goal if you had chosen the clinical stream. The goal is to increase my clinical knowledge and expertise related to nursing care of the pediatric patient with potential sepsis. So I want you to know that this is a personal learning goal and it's not an organizational goal. It's not focused on a particular project. It is focused on the learner. You would find this exact same goal in your abstract, and it would be linked to other parts of the proposal. So it makes sense given the organizational goals and the outcomes that you're hoping to achieve. After you have identified and finalized your learning goal, you need to develop your learning objectives. Objectives will support the achievement of your goal, and again, they need to be focused on your learning. You need to develop between 3 and 5 objectives. And all learning objectives should include a verb or action word. I'll give you some examples in a minute. Use the acronym SMART to make sure that your objectives are well written. SMART stands for specific, measurable, attainable or achievable, realistic, and timely. And an objective that follows SMART is more likely to succeed because it helps you know what you need to achieve and how to measure completion. So just to explain this, specific, an objective that's specific is detailed, it's focused, it's clearly stated, and everyone who is reading the objective should know exactly what you want to learn. Measurable, a measurable goal is quantifiable, meaning that you can see the results. Achievable or attainable means that the objective can be achieved based on your skill, resources, the area of practice, and also the time frame. Relevant, a relevant goal applies to your current role. It's clearly linked to your role and your responsibilities at your organization. And time limited, a time limited objective has specific timelines and a deadline. So you might want to Google SMART if it's been a while since you've applied this acronym, and there are lots of great resources out there to use. Here are some examples of SMART objectives that align with the goal that I outlined before, and the goal being to increase my clinical knowledge and expertise related to nursing care of the pediatric patient with potential sepsis. So these objectives, number 1, by the end of week 4, I will identify and select evidence-based guidelines that can be used to increase my knowledge on the topic of pediatric sepsis. Objective 2, by the end of week 6, I will be able to accurately describe signs and symptoms of pediatric sepsis. And objective 3, by the end of week 10, I will be able to demonstrate how to conduct a thorough assessment for pediatric sepsis that's based on best practices. So these objectives, I want to point out, follow in logical order. They flow and they help to outline how you're going to meet your goal. They are specific, measurable, attainable. This would depend on the baseline skills that you have and the knowledge of the fellow. And they're relevant and linked to a time frame. Each objective includes a verb, and you can see that in orange. We have identify and select there, we have describe, and we have demonstrate. So to remember to use verbs in your objectives, and online you can look for examples of verbs that are useful in objectives. Bloom's taxonomy I find is pretty helpful when I'm looking for just the right verb. So you can Google Bloom's taxonomy if you're interested. That's B-L-O-O-M-S. Step 3 is identify your activities. And this answers the question, how will I meet my objectives? So in your learning plan, you need to make sure that you clearly identify and describe which activities that you will plan on doing to meet the objectives. Get creative when thinking about what activities you can engage with, and select a variety of strategies for each objective. Involve your mentors, and if you have a mentoring team, get other people involved to help you come up with ideas, and we encourage you to look outside of your organization to other external opportunities so that you can gain a broader perspective. And here are some examples of activities. So conducting a literature search or literature review, going to conferences related to the focus of your fellowship. Shadowing experiences are often really helpful. Reviewing policies or procedures, connecting with subject matter experts on the topic, and going to site visits to other organizations. So here are some examples, and I just want to reinforce that although we want you to be creative and have a variety of strategies for each objective objective, you need to keep in mind the scope of your fellowship and make sure that you can do all of these activities realistically in the time frame allotted. I'd like to give you an example of how you would link activities to an objective. So here we have one of the learning objectives that I listed earlier. It says, by the end of week 4, identify and select evidence-based guidelines that can be used to increase my knowledge on the topic of pediatric sepsis. And to achieve this objective, I've come up with 5 learning objectives. And as you can see, they are sequential in order. The first one is to attend a webinar on how to identify and select and appraise guidelines, so building your skill and knowledge on that topic. You might next meet with your primary mentor to discuss the search strategy and your plan for selecting evidence-based guidelines. After doing that, your next activity might be to go straight to performing the search strategy and identify guidelines for appraisal. The next activity might be to appraise guidelines for quality together with members of the mentorship team. And a final activity would be to compare results with members of the mentorship team and select key evidence-based guidelines. So there are 5 activities for this one objective, and some of your objectives may not require this many activities, but I just wanted to give you an example. The next step is to name the people who will contribute to helping you with the activities. So think of all the people you will involve. This is an important part of your planning, and you might be surprised at how many people would actually be engaged with your fellowship, including mentors, maybe managers, maybe your colleagues. And it's important that you state how you will communicate with each of these people. Here are some examples of communication strategies you might use. So you could meet in person with the primary mentor to plan and discuss the guideline search strategy. You could provide a verbal report, maybe a PowerPoint presentation to your mentorship team. Maybe you would conduct a teleconference with your mentorship team to discuss appraisal results. And you might decide to email your manager maybe before and after you go ahead and appraise the guidelines. Now we'll talk about the timeline. So we have this as the 5th step here, but always keep in mind the time frame of your whole fellowship and what you can feasibly accomplish within the 450 hours. So we ask that you include a start and end date for all of your activities, and this ensures that you think through everything that you want to do, arrange things in sequential order, and consider how much time each part will take. So you don't have to put in calendar dates like May 5th to 12th, because you won't know these dates at the time that you write the proposal, but do consider how many days or weeks each activity will take you. And this is to your best estimation. Just consult your mentor or other people who may be involved, like your manager. And we ask that you put in start and end dates for all activities. So here's some considerations. Are you conducting the fellowship full-time or part-time? Are there any holiday days or vacation time within your time frame for you or others involved? And be clear on your mentor's availability. Keep in mind the sequence of activities and what needs to happen first. Be realistic about how long some of the activities will be taking and your scope, and organize based on the number of weeks, and keep in mind always the completion date. The last step in the learning plan is stating the evaluation criteria for success, and you write the evaluation criteria for each of your objectives. It answers the question, how will I know my objective was successfully achieved? And what criteria will I use to determine success? So evaluation criteria should outline how you will determine that you have successfully achieved your objective, and how will you determine you have achieved it well. For example, to what standard will you aim for? Indicate the approach you will use to evaluate your success. So, for example, is it written feedback? Is it a survey you're doing? Is it reflective journaling? Specify which individuals will be involved in which objective. An evaluation criteria should be clear and concise. It should be concrete and measurable. So if your objective from the start is clear and well thought out, then it will be much easier to determine if you have met this objective. So I'd like to give you some examples of evaluation criteria for objective number 3 that was stated earlier, and that is by the end of week 10, I will be able to demonstrate how to conduct a thorough assessment for pediatric sepsis based on best practices. So a couple of examples. Using an evaluation rubric, my mentor and at least 2 experienced nurses will observe and provide feedback on a pediatric assessment performed in the lab. And the second example, together with my mentor, debrief the pediatric assessment in comparison to best practices and indicate areas of strength and improvement. So as you can see, these are clear, concise, they're concrete, and they're measurable. They state the criteria that you're going to use and who will be involved. So we're near the end of the presentation on your learning plan, and I'd like to summarize the steps in the learning plan and establish some of the key points for you to remember. So with your goals, these should be focused on your learning. They need to be appropriate for your stream and align with other aspects in the proposal. Your objectives, please include an action word, a verb, and ensure that the objectives are SMART. With your activities, we recommend that you look for a variety of activities and look for opportunities outside your immediate practice setting. And the opportunities should be meaningful to you. They should add value to your learning experience, but also realistic for the time frame. For your contributors and the communication strategies, remember to specify who is going to be involved and how you will communicate with them. So be clear on what your mentor's role is and the other contributors' roles are in this section, as well as in the evaluation section. For the timeline, this should be appropriate and reasonable for the 450 hours. So ensure that you have allotted the right amount of time for the fellowship activities, and that your activities also flow in a logical sequence in the time frame. The evaluation criteria for success, so remember to make these really clear and use them to help you determine whether or not you have met your objectives and if you've met them well. So overall, what we recommend is that you review and you review and you review your learning plan. The primary mentor, and if you have a mentoring team, they should be involved in reviewing the learning plan before submission. And anyone who's involved in your learning should be clear on the expectations and the scope of their involvement. So remember that your learning plan is a roadmap for your fellowship. It does take time to complete a learning plan well, and learning plans that are created in a collaborative manner tend to be most successful. Well, thank you for your interest in the ACPF Fellowship. I hope you found this video helpful on developing your learning plan. For more information, please visit the link that you can see on your screen.